Good afternoon, everyone, and welcome. My name is Louisa Flynn, and I'm the Senior Vice President at PARC for Strategic Communications, Marketing, and Sales. And I'm excited to introduce our speaker today to all of you. So we're going to get started right away. I just want to make sure everybody can hear me clearly. Yes? Good. I see thumbs up. Okay. Great. Okay, so here we go. I'd like to introduce John Diggle. Dr. John Diggle is a neurologist, a clinical professor in the Department of Medicine at UBC, the Regional Department Head of Medicine, Fraser Health, Regional Medical Director at Fraser Health, and Chief Medical Officer, Elysian Health Group. And he also has a clinical practice in White Rock. Wow. That's a lot of stuff. So apart from that, he's an all-around kind of nice guy. He knows certainly what he's talking about, and he knows a little more than probably all of us about vaccines. So I'm going to turn it over to John Diggle. And just remember afterwards, if you do have some questions, you can ask the active living manager or the wellness nurse who is there. And then if we have some time at the end, apart from the questions that I did get from all the residences, we will be able to ask a few more at the end. Okay, so it looks like everybody's in. It looks like a few more are coming in right now, but we're ready to go. Dr. Diggle, over to you.
Thank you. I'm excited about the format today. So we're entering into a new phase of the pandemic. There's a lot of questions about vaccines and what happens next. And the chance to talk about that and let you know what we're planning provincially and how that might affect you as residents at PARC is exciting for me. So how we've structured this is I have a list of questions that residents have asked, and I'm going to try to do my best to answer them. I'm going to try to be succinct. I'm going to try to be clear. If there's follow-up questions or expansion that's needed, your teams will have ways to get further questions to me. So we're entering to this new phase of the pandemic, and much of the talk has been about vaccines over the last few weeks. A lot of just insightful and appropriate questions about vaccines or what I've been given. And I'm going to try and answer those to the best of my ability. So the first question is probably the most important. When will we get the vaccine? So our vaccine rollout in British Columbia is right now, this week, today, entering into something we call phase 2. Phase 1 was trying to immunize the highest risk groups, the frontline healthcare workers, people who are at higher risk than you as residents of PARC, meaning people in long-term care facilities or in assisted living. We've completed that phase of our work. So we now have all of our first line and all of our long-term care and assisted living patients immunized. So we're now able to shift focus, and we're looking at how we get the vaccine to everybody else in our province. So when will we get the vaccine? Very soon. I'm being vague about that. On the news this week, you just heard about some production changes in Europe that have affected the flow of the vaccine to Canada. Hearing those talks, I trust very much nationally and provincially the security of our vaccine supply. It has caused enough of a pause that we don't know exact dates for everybody in the province yet, but it will be in coming weeks. Our next phase will begin with people 80 and above and 75 to 80. So we anticipate in coming weeks having real clarity about when precisely you as individuals will be getting those immunizations. So we're done phase 1, moving to phase 2. It'll be very soon. Where will I get the vaccine shot? In our residence or at another location? I thought this was also just a fantastic question, because we are still working out precisely where every individual 75 and above is going to get that shot. Different models are being looked at. Hub clinics where people in close adjacency will go. For places where multiple people 80 and above live. places like an independent living facility? Do we have the capacity to get the shots out to the facility? So we're working through both of those models. Probably in different parts of our province, those models will have to be modified depending on the local environment. The main challenge we're going to have provincially is the need for what's called cold storage or cold supply chain with this particular vaccine. Pfizer is the one that we're using in most of our large urban centers. It needs to be kept minus 70 degrees or less. That might be our limiting factor when we think of how we get it out to independent living facilities or whether patients need to go to where the vaccine is. We're trying to be as patient-centered as possible, but that cold storage might limit our ability to be truly patient-centered and get out to people's homes. So that story is evolving very quickly. Which vaccine will I get? Of the potential vaccine candidates, which one should I take? And is one better? Almost certainly, you will be offered the Pfizer vaccine. We do have a supply of the other vaccine called the Moderna vaccine. It can be stored at minus 20. We are using that provincially for most of our remote communities. So trying to get it up north, trying to get it way out east into the valley. The larger urban centers where there is the ability to store things at minus 70 degrees are largely being offered the Pfizer vaccine. Practically, that matters in how we distribute it. It doesn't matter on your end as a patient when you're offered it. They are equivalent. So they both are 95% effective. Whichever's being offered is the first one you take, and they're both equally effective. So I wouldn't be worried about you being offered Moderna or Pfizer. It'll probably be Pfizer for us in the Lower Mainland. When will the second dose be given? Another great question. This is really on the news right now. You're hearing about some groups of doctors. You're hearing about some groups of nurses or even some political groups in other countries talking about how to get the second dose. The thought of this in British Columbia is reflecting the thought of the World Health Organization. So it is very much in line with international guidelines. You'll probably get your second shot about 35 days, maybe out to 42 days after your first shot. But as the worldwide experience with this vaccine is growing, you'll hear a lot of talk about how it was studied at 21 days or 28 days, the second dose 28 days after the first. As the worldwide experience is growing, we know that it's just as effective as getting it out at 35 or 42 days. So I really do trust what I'm hearing on the news from Bonnie Henry. If we are 35 or 42 days after the first, it's going to be safe. That's what the science is suggesting. So when will the second dose be given? Probably about 35, 42 days after the first, and fully safe and fully effective that way. Question 5, can I catch COVID from the vaccine? You cannot. You can't. This is something called an mRNA vaccine. There's no live virus, no attenuated virus. It's only a fragment of a particular type of protein called mRNA that's in that vaccine. No chance of getting COVID from it. Number 6, how effective is the vaccine? Can I still get COVID even though I have the vaccine? So how effective is it? I want you to think about this in 2 different lines. So first, how effective is it at preventing COVID, all of COVID in general? It is 96%. We can be very specific. This has been well studied, and we've looked at it across the world. It's 96% effective in preventing all COVID. So any symptoms, runny nose, loss of sense of smell or taste, 96% effective. More importantly, I don't want to minimize that. That's important in itself. But more importantly, when we think of our populations, it's 100% effective in preventing serious COVID, death, hospitalization, getting into the ICU. So 100% effective in the more serious forms of COVID. There are some people after a vaccine that can go on to develop COVID. So you can still be exposed to the virus. It can still take root. It doesn't take root enough to create serious illness. So the second part of that question, can I still get COVID even though I've had the vaccine? A minority of people can, 4%. But it doesn't seem to be able to take root and cause serious illness. So it's effective in preventing the most serious forms of that illness. Number 7, if I get the vaccination, is there a chance I will be asymptomatic and transmit the virus? Yes, that's possible. You can still get it. The virus might not replicate enough to cause serious illness in you, but it can replicate enough to still take root and transmit. That's not unique to COVID. And that's not unique to these new vaccines. That happens with all of our vaccinations. So that's a common part of how vaccines work. They give your immune system the advanced warning to fight off an invader as soon as it detects it. But the invaders still come into your body. You still inhale the flu virus. Your body will fight off the flu virus before it can take root. But there's a short period of time when you're exposed, it has taken root, and before you fight it off, you can still transmit. That's going to be an important thing to remember when I talk about other things like maintaining social distancing or still needing to wear a mask, or why you might not be able to travel immediately. And so that's an important concept. And that's why I'm sort of, I'm trying to get Bonnie's back ahead of time. I'm trying to let you know biologically why. So can you be asymptomatic and still transmit the virus? Yes, you can. If I already had COVID and I have antibodies, do I still need the vaccine? Shifting to that next question. So if I previously had COVID, do I still need the vaccine? You do. COVID is a living organism and your immune system is very complex, and not all types of COVID or proteins on the surface of COVID generate the same immune response. These vaccines were designed to pick out the most inflammatory and the most immune provoking responses. So just because you had COVID, it doesn't mean your immunity will last as long as we would expect with the immunizations. And people that have had COVID, we're still encouraging to get the vaccine. What are the side effects? Great question. The side effects of this vaccine, the Pfizer or the Moderna that we will be offered in BC, are very similar to your annual flu shot and very similar to other immunizations that you've had in the past. You'll have local side effects, redness, heat, swelling, arm aching. Those generally last about 2 to 3 days. There are a minority of people that might feel systemically unwell. They get not just inflammation at the site, but they get inflammation over their body. They can get muscle aches, headache, fatigue, even some nausea. And there's been reports of people who have even vomited for a few days after the injection. Those are rare. They're much more likely after the second dose. And that's because it's really filling in your immune response. But in general, it's very well tolerated, this vaccine. So we've been very happy with it. Will the side effects be worse if I'm taking any specific medications, if I have certain conditions, or if I'm lactose intolerant? No, there's no medications that make it more likely to have a side effect. There's no medications or lactose intolerance or any other conditions that will make it more likely to have side effects. And how long do side effects last? Typically about 2 days as the immune system is starting to respond. There was another question that came in afterwards about, are there any supplements or any prevention strategies I can use after I get the injection if I want to avoid side effects? Are there any supplements or any other natural therapies to prevent? As far as we can tell, no. We would advise most people to take a low-dose anti-inflammatory, Advil or similar medication, unless your doctor's told you that you can't take those, just to ward off any of the aching. But so far, no clear benefit of any supplement in warding off those side effects. If I have allergies or I have a suppressed immune system, is it safe to take this vaccine? Yes, but there's a but on this one. So yes, it is safe, but ... When you get your injection, the person who's giving your immunization, and I've run an immunization clinic, they're very good at doing this with every patient. They will ask you a number of questions. There's a couple of allergies that you need to be aware of, but they're uncommon. There's something called polyethylene glycol and something else called polysorbate. Those are agents in the immunization that people can be allergic to. Sometimes they're in cosmetics, sometimes they're in hair dye. If you've had allergic reactions to those, and the immunizer will ask you, you don't have to remember this, the immunizer will take ownership and they'll go through a questionnaire with you. But if you've had allergic reactions to those substances, it might cause them to pause and reevaluate the safety of it for you as an individual. The other component to that question, so that's allergies. You don't need to worry about lactose intolerance, and the immunizers will ask you about these particular chemicals. The second question was, if I have a suppressed immune system, is it safe? Again, yes, but ... The immunizer will ask you very specifically about certain medications that can suppress your immune system. High dose steroids, chemotherapy medicines, some illnesses where your immune system is faulty, like lupus or rheumatoid arthritis. The immunizer will take control of that. It's safe for people with those conditions to get the shots, but the immunizer will want to know that about you, and they'll work with you to make a judgment call about risk and benefit at that time. So blanket statement, allergies, immune issues, go for the shot. There may be an extra level of conversation for you when you get there. Okay, but safe. I hope I'm not moving too fast. I apologize, but the questions are exciting and a lot of content. I'm about halfway through, a few more questions. If I take the vaccine, does that mean I can travel? Can I roam freely with no mask and do all the things that I did pre-COVID? No. You will still be under a public health order from our chief medical officer and our chief public health officer. So you're still going to have to adhere to every other public health measure. And I want you to remember my answer to an earlier question. Why? So why is that? It's because you can still absorb and transmit and spread virus. It is not likely. You're not going to be shedding a ton of virus because not a lot of virus has taken root. That's why you're safe with the vaccine. But not everybody around will have had the immunization yet. And you guys are going to be the first. We're going to be starting in our province 80 years and above, then quickly thereafter 75 and above. But most of the population out there is not going to have the vaccine yet. And not everybody 80 and above will have had it yet. So even if you have, your neighbor at bungalow down the street might not. And so I really don't envy that component of Dr. Henry's job. She's balancing not just your risk, but the risk of everyone. You'll have to be adhering to all public health orders around that. I'm looking for a day when that could have been a totally different answer. I know my household is very different now than it was 6 months ago, but we'll get there. And this is very front of mind for our public health officers. How long after getting the vaccine do we know we're protected? How long will the protection last? The science is suggesting you are well protected for at least 6 months. Most of us, thinking of the broader experience with other vaccines, would anticipate year or years of protection. As this vaccine story evolves across the world, we'll have much deeper insight in coming months. So by the summer, we'll have a much better sense of how long that immunity lasts. This is a game changer though for COVID. At least 6 months, probably years. How much will it cost me to get vaccinated? Nothing. And again, I'm assuming that our audience here is all within British Columbia. Your vaccines will not cost anything in our province. Are there any long-term consequences of vaccinations? No. So none yet reported. We have a huge safety net. This is actually an active question that's reviewed daily at our province, daily at the health authority level, daily nationally and internationally. So there's a number of local, provincial, national, and global systems designed to capture this exact information. So far, remember, we didn't just start vaccinating in December. This has been well studied over the last year. So far, no long-term consequences. We're trying to understand. Overall, this seems to make people a lot safer with very, very few side effects. Should I wait to get vaccinated until more research has been done? And again, I I trust the individuals and the systems involved. Should I wait to get vaccinated until more research has been done? No. Any research that needed to be done to make sure that you were safe and make sure that this was effective has been done, or we wouldn't be doing it. So should I wait? No. If they're calling and you're comfortable and you meet your immunizer and you're comfortable with them and they've answered your questions, once it's offered, I would go for it. Last question was, did the vaccine trials include seniors? Very specifically, and a very specific ask for the US and Canadian governments and European governments and Australian governments, you must include seniors. They're at the highest risk for this illness. And yeah, Pfizer included 22% and Moderna had 25% of seniors in their trials. So when I talk about safety and when I talk about effectiveness, I'm talking specifically about you. This was studied, it's safe and effective. Those were my questions. Those are my answers. I hope that adds some understanding for you. I'm happy that we're finally moving into this level of conversation when we're talking about how to get this out to people, not just in an emergency room and not in a hospital, but people who are living, being safe. I'm happy that we're finally here. So thank you for having me. I'm excited about this. Stay safe as we are waiting for this to be deployed to PARC facilities. Even as of last night, I was speaking with the chief medical officer in charge of immunizations at Fraser Health. So I'm speaking now for a small group of that PARC community. But right now we're still working out, or actively working out, how to get it out to you. So it'll be happening very soon. Thank you for being patient. And that's all I have to say about that. So thank you.
Well, thank you. Thank you, Dr. Diggle. Can everyone still hear me? I am back on. Yes, good. Okay, let's just have a few questions if there's some burning questions out there. And also I do want to make sure that you all know that this is being recorded, so you can talk to any family members if they'd like to also hear it. It will be up on our website, on our YouTube. And also, you can tell them tomorrow if they want to tune in via iPad or through the iPad Lending Library at the Residences for Other Residents. And some of you, if you want to tune in again, you can probably go to the iPad Lending Center or the Business Center and see it again, if not in the multi-purpose room, same time tomorrow. But let's just see if anyone right now has any questions we did not answer. I think for any of the active living managers, you can either talk straight in or put it on the Q&A and we can have Dr. Diggle read it out. Yes, Jennifer Lewis at Mulberry has some questions.
What's your question, Keith? Keith, you have a question?
I have a question.
Yeah, yes, please ask.
Reference has been made to a delay in the second vaccination with several days or even weeks between the first and second. Comments have also been made that it should be done whilst it's still safe. How can it possibly be unsafe, even if the delay is 30, 40 or 50 days?
Yeah. So the risk with the second dose of the immunization is getting it too soon. So I'm going to give you a couple of numbers. The first shot you get makes you 92% effective. It's 92% effective at preventing COVID. The second dose makes you 95%. It's better. And when we look at, 5 million people in British Columbia, 3% matters. So across our system, it is vital that everybody get their second dose. At an individual level, 92 compared to 95% matters, but it's a small impact on you as an individual. And so what Dr. Henry is doing, and what many governments across the world are doing, is they're saying, okay, if that second dose could be given at 35 or 42 days and still get you 92% to 95%, and if in that couple of weeks I can use my extra doses to get a lot more people up to 92%, I have a better chance of squashing down this virus. And so that's exactly what's happened. After this vaccine was released, the World Health Organization took a look at the global experience, and we understood that even if your second shot came in at 35 days or 42 days, you're still going to get to 95% from 92%. And so it's not a race to get you in at the 21 or 28 day mark. You have to get that second shot to get you up to the full benefit of this vaccine. But by delaying it 1 week or 2 weeks, Bonnie Henry was able to get 150,000 extra people vaccinated up to 92%. So across the population, we are much more likely to get back to normal daily life by spacing out that second shot and not doing anybody significant harm. Medically, looking at her rationale, understanding the science, it's really, really hard to see any other way. I think this is the right move. Medically, remember, everybody's trying to catch up with the science. She seems to be leading, and most organizations are moving towards that sort of delayed second phase. I think entire countries, I believe, don't quote me on this one, but I believe the entire UK moved to a second vaccine delayed that way.
Great. I have another question from Summerhill. After I've gotten the vaccine, if I have some of the symptoms, how do I know if I'm just experiencing a reaction or if I have COVID? Should I get tested in those first couple of days after getting the vaccine and experiencing symptoms?
So if you are feeling unwell and if you're feeling, short of breath, runny nose, and you've got questions, you should be talking to one of your providers and one of your team members. Use common sense as you're approaching your own health, especially with this virus. If you're experiencing symptoms similar to what's being described by me, or remember, you'll have somebody else talking about the side effects before you get your shot, and you'll have another layer of questions and answers. So if you're experiencing anything that's not what's described, not having those local effects, or having side effects that are so severe you're not functioning, talk to your provider. Talk to your provider. People can truly, it's not common, but it was very well understood in the trials, people can get COVID between their first and second shots. It's 92%, not 100% effective. And you might get your shot and then just accidentally be exposed using common sense. And you wouldn't be where you are right now if you didn't have common sense, but using common sense as you approach your health is the best thing you can do. Yeah, you can get tested. It is very unlikely, but possible. Talk to your provider if you're feeling out of keeping with the side effects that I've described.
Thank you. Another good question from Oceana. This is interesting. For the second vaccination, if you cannot get the second vaccination in the time period, would you have to get the vaccination all over again?
No. So we don't want to treat you too early after your first shot, because then you don't actually get up to 95. You might get to 93 or 94. But if you're out to 42 days, 5 weeks, 6 weeks, we don't worry too much about the later component. If it is delayed by 6 months or a year, if you were traveling or otherwise unwell, or you couldn't get to that second shot, if there is a 6-month mark, we might reevaluate the need to go through another booster. But no, your public health nurse and the public health team will help manage that for you.
Great. Another question there. What if you can't get the same brand of vaccine for the second vaccine? Would it be effective if you get the Pfizer first and then Moderna as a second? Is that even possible?
Fantastic questions. So no, you should be getting the second dose, the same brand as the first dose. the public health teams across the province are trying to work out exactly that complexity. Remember, we have never done this before. We have never tried to immunize the entire world with a fixed supply chain of vaccine. And we're doing this at a pace and a tempo that's very different than polio or smallpox. We are doing this rapidly. So they're working out systems to track who in the province gets what vaccine, and you'll get the exact same dose, but they're on it, they're tracking it, they'll know what you got before, and they'll give you the same manufacturer afterwards. I love the questions, because this is exactly what's keeping them awake at night, every night. I know it is.
Well, I have a few more coming at you from Cedar Springs. I've just had a patch of skin cancer removed. Will I still be able to get the vaccine? And another one, can diabetics get the vaccination?
That's an easy one. Yes and yes. No worries with the skin cancer. No worries with diabetes. No worries with recent surgery.
Okay. Another one, I'm only 76 years old. Will I be excluded from the first round of vaccinations with all of the other residents, most of them who are in their 80s?
Yes. Excuse me. So fascinating question. And there's some complexity to how I answer this. So strictly speaking, we are looking at the next round, that first phase, 80 and above. So you got that from my first talk, and that'll be on the news. We're then looking at 75 to 80. We don't yet know, because there's some subtlety with facilities like PARC, where people who are 75 are living in close adjacency to people who are 80. So what we believe is that in people who are cohabiting, so who are in the same facility, we might need to look at immunizing at a lower age group, depending on who's in that household. We don't yet understand the scope or the impact of that, or how that affects other high-risk groups across the province. So actively right now, they're understanding how they're going to do that at all facilities. A politically correct response. We're not sure. Probably we'll understand better in coming days.
And it looks like I have one last question here. Is there anything that will be done, perhaps from Dr. Bonnie Henry, to ensure we get the second vaccine within that 30 to 40 day window?
Yes, they are working very hard with national and international supply chain, and we have benchmarked the days and the interval for your second dose. So they are right now committing to exactly that interval for everybody in our province, 35 days.
Great. Ali, we have 1 minute left. If you have another question, or any of the other residences, if you have another question for Dr. Diggle, anyone? Everybody's good to go? Wait.
There's a question.
One more.
The doctor said that when the first group is already done, and we're moving ahead to another age group. So, and he said that that group was already finished. And my question is, did they all get 2 doses in the first group?
No, they all got 1 dose.
Can we repeat that question so that everyone, I don't know if everyone's heard that.
So the question was, in phase 1, where we got all the frontline workers and people living in assisted living or long-term care, have they all gotten 2 doses? No, they've all gotten 1 dose. And the strategic decision was, before giving them a second dose, let's get everybody else the first dose. We still are aware they need a second dose at some point, but no, they haven't gotten a second dose. The next group will be you.
So is that going to happen in all groups? You're going to have to maybe wait longer for your dose, or maybe not even get it at all?
Good question. So there's going to be something about the supply chain that will limit us. And there's some biology we need to worry about. We don't want to leave it 6 months. And so we'll probably have a staggered approach, that there will be some groups that start to get their second dose before, say, 65-year-olds or 45-year-olds do. It'll be staged and staggered as we go forward. They quite literally have mathematicians working on who, how long, and at what intervals can we get large groups of people. So probably ultimately you'll see that. That'll probably be on the news or in our public knowledge that some people are getting their second doses before some groups are getting their first. It's going to be purposeful. It's going to be done to maximize the safety of our entire population. And I trust them around that.
Great.
Will this affect the start time of this group? All these, all these have the second shots to get filled or whatever you gotta do there, will that affect our start time here?
No, in fact, specifically not. The first phase, the second shots were actually delayed in order to actually get to you, to get to that 80 and above and 75 and above in the community.
Great. I'm going to end it there for everyone. We do have another presentation tomorrow with Dr. Diggle. So if you do have some questions, you can be sure to give them to the active living manager or the wellness nurse, and they'll get to us. And I just want to thank everybody for giving us their time today. And thank you, Dr. Diggle.
Thank you.
And,
Thank you.
Thank you. And we'll see you, Dr. Diggle, tomorrow. And thank you very much, residents in all of our park residences.